Okay. Okay, this is, good evening, my name is Tina Nordine, and we are about to do an abdominal assessment on Mr. Nathan Nordine. Nathan is 14 years old, and he's actually my son, so I provide consent for him to do this abdominal assessment. Nathan, we're going to be sharing a video on YouTube. It's going to be listed as untitled, and my teacher is going to actually look at this video and grade me based on what I do for this assessment, okay? So can you have to say yes or no if you consent to allow me to do your video?
Yes.
Yes, you do. Okay. So Nathan, we're going to be checking your stomach today. And what I need you to do, and hopefully we don't have a videographer today, so hopefully you're able to see everything that's going on. So Nathan, I'm going to ask you, the first thing I have to do, well, I did, just so you know, I did wash my hands before I entered into my exam room today. And Nathan, I'm going to ask you to lay supine. Supine means laying down on your back right here. So I know you're tired, so it's late, and we're going to just ask you to lay flat, and I'm going to make sure that you're on the exam table. I'm going to make sure that your legs are supported as well, okay? So Mama's going to check the video real quick, and then I'll be right back, okay? I want to make sure that we are able to see you. Okay, so we're able to see you in the video. Okay, so Nathan, the first thing that I'm going to do is I'm going to inspect your stomach, meaning I'm looking at the shape of your stomach. I'm looking for any pulsations. I'm looking for any peristalsis. I'm looking for the coloring of your stomach. I don't see sclera or what's called jaundice, so no discoloration. So those are the things that I'm looking at when I'm inspecting you. So the next thing I'm doing is I'm going to auscultate. Auscultate means to listen. And you have 4 quadrants in your stomach. You have a right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. And in those quadrants, you have different organs. And so I'm going to be auscultating or listening. And what I'm listening to is for bowel sounds. And bowel sounds are pinging or tingling in your stomach. And you have about 5 to 30 per minute that I'm going to be listening for. So I'm going to be listening in each area. This is the diaphragm of my stethoscope, and this is the bell of my stethoscope. It doesn't hurt, maybe a little cold, but I'll try to make sure that it's warmed up. But I'm going to listen with both sides, okay? So what we're going to do is, this is your right side. On your right side, I'm just going to place my stethoscope here and listening for normal bowel sounds. And so you have normal active bowel sounds, meaning that they are active, but they're not hyperactive or hypoactive. And I hear that in each quadrant. Oh, I definitely hear that. I think that's that pork tenderloin you ate. Okay, and I'm just going to listen with my bell as well. And I always start with auscultation first instead of palpation or percussion, so that it doesn't mess up the bowel sounds in there and give me a false sound, okay? So next up, Nathan, I'm going to be listening for your liver, your spleen, and listening for any friction rubs or anything like that. And then I'll be listening for your aorta and listening for with my bell and my diaphragm, and then listening to your renal artery, your iliac arteries, and your femoral arteries. Now, femoral is kind of down here where your shorts are, but I'm not going to get anywhere near your private areas, okay? Mm-hmm. So I know that we want to make sure that our patients feel very comfortable. Now, our liver is located right under our rib cage on the right-hand side, and so I'm going to do what's called a hooking technique. Just kind of listen. Actually, that would be under palpation. So I'm going to listen for your liver to see if I hear any friction rubs. And sometimes it is kind of hard because your liver is located right under your rib cage, and you've got a little tiny rib cage. I don't hear any friction rubs. And then on this side, I will hear, got your rib cage here. Your spleen is actually right up underneath your 10th intercostal space. So I'll go here and try to listen for any bruise or rubs, and I don't. And then I'm going to listen to your aorta. So your umbilicus is here. That's your umbilical cord. Your your umbilicus, listening for your aorta, and I don't see any palpation. I know I've already inspected, but I'm making sure that I mention that. And then your renal artery with both my bell and my diaphragm on both sides. And your iliac artery further down just a hair. And then your femoral, remember I told you, it's kind of down where your shorts are. We've got a big artery down there that feeds our legs. And I don't hear any bruise or any friction rubs in any of those arteries at all. I'm going to listen with my bell as well, making sure that we listen to all the above. All right, the next thing I'm going to do, Nathan, is called percussion. And percussion is when I use the third finger of my dominant hand, or third finger of my non-dominant hand, and the third finger of my dominant hand. And I'm going to listen for tympany or dullness in your quadrant, your abdominal quadrants as well. Again, all four quadrants, I'll be also listening. Again, remember where I said the liver was, the spleen was, and I'll be listening to each of those areas. So, and then also your bladder. Your bladder's where your urine goes, okay? And so what I'm listening for is tympany or dullness in each of your quadrants. So I'll take the third finger. And I'm sorry, does that tickle?
No, I'm just fat.
You're not? I wish I were fat if this is considered fat. Do you hear that dullness?
Mm-hmm.
Or timpany? Timpani. Yeah, so you do that in music, right?
Mm-hmm.
All right, and so the other thing I'm going to do is feeling with a little bit of a hooking. I'm going to kind of do some auscultating of your liver, and I'm going to measure the mass of the size of your liver as well. Okay, so it goes where your liver is. I'll hear some timpani, and then I'll hear dullness. Okay, so it'll be a little bit of a different sound. So I'm looking. Here's your rib cage. I'm going to mark it right there, and then I hear dullness there. Okay, so I would say that's about 4 centimeters, which is normal. And then on this side for your spleen, here's your rib cage again. Just listening, and it's normal not to hear to hear splenic dullness, so that is normal. And in order for me to find that liver, I was going to go mid-clavicular. So here's your clavicle. Go mid-clavicular down to the bottom of your rib cage, and that's where your liver is, okay? The next area that I'm going to do, Nathan, is called palpation. And that's when I'm going to use the pads of my fingers, and I'm going to touch and feel to see if I can feel an area. So we want to start with a light touch just for the person or the patient to kind of feel comfortable with the touch and everything. So taking the pads of my fingers on your your right upper quadrant, just lightly palpating to see if I feel any abnormalities, any pulsations, any, is it ticklish?
Kind of.
A little ticklish, I'm sorry. I don't mean to be ticklish. Okay, and so I'm looking to see if there's any type of abnormalities or pulsations or peristalsis or any of that, and I don't see or feel any of that. And then next would be a deeper palpation. That's to feel a little bit further in, just to see again if there's any masses. You may feel, let me know if you feel any tenderness or any discomfort at all. Do you feel anything? No?
No, it's fine.
Oh, it's fine? Okay. And you think, see when I say lower quadrant, it's kind of low here due to your shorts, but that's where our stomach is, okay? Our colon is down here too. That's where we hold our stool, poop, okay?
I have a lot of that.
Yes, we know. All right, so then also to palpate, I need to palpate with a hooking pattern or a hooking technique to see if I can feel your liver. It may hurt just a little bit. You may feel just a little pressure, but I'm going to try to be as gentle as I can. So here's your rib cage, And is it ticklish? And I'm feeling to see if I can feel your liver, and I don't. I feel something in there. I think that's pork tenderloin, or maybe those are mashed potatoes. And that, so your liver is on this side, your spleen is over here, and I'm gonna try. Okay, so on your liver, will you take a deep breath in? Let's see if I can feel it, and I don't. And take a deep breath. You can. Okay, and then on this side, take a deep breath in, and let me know if there's any tenderness. And deep breath out. Okay, good job. Did you feel any tenderness or discomfort at all in that area? So
No.
if you had that, then you would let me know that. So in your right lower quadrant is your appendix. A lot of people have appendicitis, and so I would deeply penetrate or palpate in this area to see if there's any issues. So I don't think you have any issues there. So there's a couple of special tests that I can do now, Nathan. Ascites, that's some fluid in your abdomen. Now, you at 14 years old don't have any ascites, but I have seen patients with ascites, and what happens is their stomach gets really bloated and it gets filled with fluid in there.
That's mine.
Okay, so I don't know that that's fluid. I think that might be mashed potatoes, or maybe it was the Apple Jacks this morning. But what you would do in order to do a fluid test is you kind of push along, and you would see waves in the abdomen. If I were to push along it, I would see waves in your abdomen, and you've got a pretty nice flat abdomen, so I'm not seeing any waves there. So the next thing is called the Murphy's sign, and what I do is I'm going to ask you to take a deep breath, and I'm going to push on your right side. When I'm pushing on your right side while you're taking that deep breath, if you're having any pain, you would tell me, and then you would let me know that, and then that would be indicative of a gallbladder issue. So take a deep breath in, and I'm going to push on your right hand side. And do you feel any pain? You can let that breath go.
Yeah.
Okay, so if you were to have pain, Nathan, that would be indicative of, or that means, the word indicative means that there's gallbladder issues, okay? The other thing is, in your right lower quadrant is McBurney's point, and that would let me know if you had, right in there, so that would let me know if you had appendicitis, and I would really just kind of, what's called the rebound test. I would push on your stomach really suddenly and then let go, and you would let me know if you had any pain either pushing in or letting go. And so this is the rebound test. I would push in deeply and then let go suddenly, and that would be the rebound test. So
That
Nathan,
feels weird.
did it feel weird? Well, Nathan, I thank you for being a good patient and being able to help Mom out with this to learn how to do an abdominal assessment. So we did each and every one of those steps. And do you have any questions? It looks like your abdominal assessment is normal. Looks like you might have had too many pork tenderloins and mashed potatoes. But other than that, do you have any questions for me?
No, ma'am.
All right. Thank you.